Welcome to this video on Disaster Management Nursing Exam Prep. We will cover fundamentals, the disaster cycle, triage, management, specific disasters, and exam drills. Let's begin with the fundamentals, defining what a disaster is, differentiating between a hazard and a disaster, and looking at classifications. According to the World Health Organization, a disaster is an occurrence causing damage, loss of life, or deterioration of health, warranting an extraordinary response from outside the affected area. A key concept is the disaster equation. Disaster equals hazard plus vulnerability. A hazard is a potential threat, while vulnerability is the exposure and susceptibility to that risk. Disasters are typically classified as either natural, such as earthquakes, or man-made, such as technological or chemical incidents. Disasters are categorized by levels. Level 1 can be managed by local emergency response. Level 2 requires regional assistance, and Level 3 demands national or international aid due to massive scale. To test your basic knowledge, the Bhopal gas tragedy was a man-made disaster. A tsunami is a natural disaster. Remember, disaster equals hazard plus vulnerability. Next, we examine the disaster management cycle, which includes pre-disaster, impact, and post-disaster phases. The first phase is mitigation. The goal is to eliminate or reduce the probability of a disaster. Examples include building earthquake-resistant structures and implementing immunization programs. The second phase is preparedness. This involves developing disaster plans, stockpiling essential supplies, conducting mock drills, and setting up early warning systems to achieve readiness. The third phase is response, which is the immediate reaction to save lives. This includes search and rescue, triage for sorting patients, and providing stabilizing first aid. The final phase is recovery. This starts after the immediate threat and can last years. It involves restoring infrastructure, rehabilitation, and long-term reconstruction. If asked about activities in the mitigation phase, remember that building strong structures falls under prevention, making it mitigation, unlike response or recovery activities. Triage is critical in disaster nursing, derived from the French word to sort. The principle is to achieve the greatest good for the greatest number with limited resources. Standard triage uses 4 color codes: red for immediate, yellow for urgent, green for minor, and black for dead or expectant. Red tag patients are critical and life-threatening, but treatable. They require immediate intervention, such as those with respiratory distress or uncontrolled hemorrhage. Yellow tag patients are serious, but stable. They can wait for a short time, typically 30 minutes to 2 hours. Examples include open fractures without major bleeding. Green tag patients have minor injuries and are considered, quote, walking wounded. They can wait for hours. A key strategy is to ask all ambulatory individuals to move to a designated area. Black tag patients are either dead or unsalvageable. In a mass casualty setting, resources must be focused on those who can be saved. Examples include those with massive head injuries or no pulse after opening the airway. The START method, simple triage and rapid treatment, uses the RPM assessment, respiration, perfusion, and mental status. Anyone finding exceeding parameters results in a red tag. A patient with a stable open fracture who is alert would be tagged yellow. They are serious, but stable enough to wait and cannot walk to the green area. A tension pneumothorax is tagged red. A sprained ankle is green. Cardiac arrest in a mass disaster setting is tagged black. A community health nurse's role spans all phases: risk assessment pre-disaster, triage during the event, and disease surveillance and psychological support post-disaster. Every hospital needs a disaster plan. Standard codes like Code Red for fire and Code Blue for medical emergencies are essential for quick communication and action. The Disaster Management Authority in India was established under the Disaster Management Act of 2005. After a disaster, major health risks include waterborne diseases like cholera and typhoid, vector-borne diseases, and respiratory infections due to overcrowding. Bioterrorism Category A agents pose the highest risk. These include anthrax, smallpox, plague, and botulism, requiring high vigilance and preparedness. The Disaster Management Act in India was enacted in 2005. Post-traumatic stress disorder, or PTSD, is common among survivors and rescue workers. It can be addressed using psychological first aid and debriefing during the recovery phase. Water and sanitation are priority 1. The minimum water requirement is 15 to 20 liters per person per day. Chlorination is the best disinfection method. In emergency situations, the recommended free residual chlorine level in drinking water is 0.5 to 1.0 ppm due to the high risk of contamination. Quickly review hospital codes: code red for fire, code blue for cardiac arrest, and code pink for child abduction. Anthrax is significant in bioterrorism. The inhalational form is the deadliest. It is caused by Bacillus anthracis. Ciprofloxacin, or doxycycline, is the drug of choice. The standard protocol for earthquake safety is to drop to your hands and knees, cover your head and neck under a sturdy shelter, and hold on until the shaking stops. The chairman of the State Disaster Management Authority is the Chief Minister. The chairman of the National Disaster Management Authority is the Prime Minister. Mass vaccination is generally not recommended immediately unless there is a specific outbreak risk. Measles vaccination is a high priority for children in overcrowded camps. The myth that dead bodies immediately cause epidemics is false. Priority is identification and dignified management. Handlers should use appropriate PPE. In summary, remember disaster equals hazard plus vulnerability, the 4 phases of the disaster cycle, and the 4 triage color codes: red, yellow, green, and black. Thank you for watching this video. Best of luck with your exams.